Today, we delve into a critical topic in companion animal health, high-rise syndrome in cats. This condition refers to the collection of traumatic injuries occurring when cats fall from significant heights, typically from windows or balconies of apartment buildings. It has been a recognized issue in veterinary literature since it was first described in 1976. While many cats remarkably survive these incidents, the injuries they sustain can range from mild to extremely severe, sometimes leading to tragic outcomes. This syndrome is particularly common in urban environments where tall buildings are prevalent, placing cats at a higher risk compared to those in more rural settings. Cats often engage in playful or hunting behaviors, like chasing birds or insects, before these falls occur. Our discussion today is based on a comprehensive two-part study conducted by Mario Candela Andrade and colleagues, which analyzed a substantial population of cats treated for this syndrome in Berlin, Germany. This extensive research aimed to clarify existing inconsistencies in the literature regarding the relationship between fall height and injury severity, as well as epidemiological patterns, including seasonal variations and architectural risk factors. The first part of their work focuses on the epidemiological patterns and associated risk factors of these feline high-rise falls.
That's right. Previous studies have presented a somewhat muddled picture when it comes to understanding high-rise syndrome, especially concerning how the height of a fall might influence the severity of injuries a cat sustains. Some research has suggested a straightforward, linear increase in injury severity with greater fall heights. However, other studies have pointed to a more complex, curvilinear pattern, where injury severity might actually peak at intermediate heights and then surprisingly decrease at extremely high falls. To add to this complexity, some investigations have found no definitive pattern at all, making it difficult to fully grasp the injury mechanisms involved in feline falls. Beyond the height of the fall, there's also been limited research on how various environmental and temporal factors, such as seasonal changes, the time of day, and even building design, might influence the frequency and severity of these accidents. For instance, while many studies in Europe and North America link a higher incidence of falls to warmer months, observations from warmer climates suggest a lower incidence during the hottest and most humid periods, possibly due to the widespread use of air conditioning leading to closed windows. These inconsistencies and gaps highlight a significant need for a large-scale, standardized investigation to provide clearer insights into the trauma patterns associated with high-rise syndrome. The study we're discussing today aimed to bridge these gaps by analyzing a vast dataset, hypothesizing that epidemiological factors like age, sex, seasonal variations, time of day, impact surface, and fall height would indeed influence the risk and severity of injuries.
Thank you for listening to the Veterinary Medicine Digest. If you're enjoying this, remember to like, share, and subscribe as proceeds from this channel go directly to providing vital veterinary care for animals in need.